Hello everyone, welcome to this presentation and thank you for joining. I'm a pharmacist at Apoticum and I will present this training on the filtration of drugs in harm reduction and the different filters used by people who inject drugs. So before starting the presentation, I would like to say a few words about Apoticum, which was founded in 1992 as a non-for-profit organization by physicians who wanted to improve injection drug use practices and also promote safer ways to use by injection. With the development of the first injection tools and the increased need for them, Apoticum distribution was created in 2008 and distributes harm reduction products in more than 25 countries today. Apoticum's mission includes the evaluation of risk behaviors in persons who inject drugs, also research and development to offer supplies adapted to the persons who use them, and always with a close link to the field, and the promotion of safer injection practices through education and information. This presentation will be divided into three parts. First, we will review the filtration of drugs, see why it is important and beneficial to filter, and the different filters that are used. Then you will watch demonstration videos that cover the correct use of some of our filters. And finally, there will be a short last part to review hand hygiene and preventable infectious risks more in detail. Why filter is probably the first question to ask when talking about the filtration of drugs. So whether a person chooses to inject illicit drugs or crushed medications, all injected substances are contaminated with insoluble particles and germs. Insoluble particles or solid particles can whether be cutting agents in illicit drugs or excipients in oral medications. For example, they can be binders or fillers that are part of inactive ingredients in tablets or capsules. So these particles do not dissolve in liquids, so not in water, not in blood, and this is why their injection can be at risk. Germs are also referred to as microorganisms and include bacteria and fungi, and their injection can lead to infections such as, for example, abscesses. Because of those contaminants present in injected substances, persons who inject drugs are exposed to several health risks, including vein damage, but also vascular and cardiopulmonary complications and infections. The other parameter to consider in filtration is the size scale of the contaminants that are present in the mix to inject. And this is what you can see on this scale from the largest on the left to the smallest on the right, as well as the filtration levels that can be reached, depending on the filter that is used. So if we start from the left, we first find insoluble particles, which size is from 10 to more than 100 microns or micrometers, depending on the substance. So at the microscopic level, this makes insoluble particles quite large, and they can be easily removed by 10 micron membrane filters, such as the Sterifilt Basic or the Sterifilt Fast. Then in the center, we will find germs, so fungi and bacteria, microorganisms that can cause infections in persons who inject drugs when they are injected, and which size is from 0.2 microns to 10 microns. So they are smaller than insoluble particles, but still large enough to be removed by filtration if a 0.2 micron filter, also called bacterial filter, is used, like for example the Sterifilt Plus. Similar filtering membrane can be found in wheel filters, sometimes used by persons who inject drugs, even if those filters are not designed for harm reduction. On the right side, we can find viruses, which are smaller than 0.2 microns, and therefore cannot be removed by membrane filters. viruses, for example, the HIV or the hepatitis C virus, are too small to be filtered, and this is why the transmission of bloodborne viruses can only be prevented through personal use of injecting equipment. The last and smallest level we found is the molecular size, which is extremely small and usually expressed in nanometers. So 1 nanometer is 1,000 times smaller than a micrometer. So this is extremely small, and active molecules such as morphine or cocaine cannot be removed by filtrations when they have been dissolved in water because they are too small. So to conclude on this slide, what is to remember is that there are different filtration levels, 10 micron and 0.2 micron being the main ones, and that depending on the filter, it is possible to remove insoluble particles and possibly, in addition to that, fungi and bacteria. Viruses are too small to be filtered, and it is also true for active molecules because they are smaller than viruses. I mentioned earlier that some vascular and cardiopulmonary complications were possible in case of injection of insoluble particles, and I will now get a bit more in detail on the damage caused by them. So first, let's take a look at the cardiovascular system that you can see on the left, in which the heart acts as a pump that keeps the blood flowing in the different blood vessels of the body. So there are two parallel circulations, the first one being the systemic circulation and the other one being the pulmonary circulation. So in the systemic circulation, arteries carry blood from the heart to organs, and veins carry blood from organs to the heart. In the pulmonary circulation, on the opposite, arteries carry blood to the lungs and veins from the lungs to the heart. Exchanges between blood and organs or lungs take place in very narrow blood vessels that are called capillaries, and which diameter is about 10 microns. When someone injects drugs in a vein, for example in the arm, the injected mix will be carried to the lungs by blood flow, and if not filtered, insoluble particles can easily obstruct capillaries. This is what you can see in the center. This obstruction will stop the blood flow in these tiny vessels, and in case of repeated use over a significant period of time, this mechanism can lead to symptoms such as dyspnea or pulmonary hypertension because of the increase in blood pressure before the obstruction site. If particles can pass the lung capillaries, they will also tend to disseminate in the whole body and can be found in many organs in persons who inject drugs, for example, eyes, kidneys, or liver. Because the body does not have any system to eliminate insoluble particles once they have been injected into the blood flow, this mechanism can be the cause of many clinical manifestations in the long run. Now we have seen the main notions involved in filtration of substances, so we will now get to the different types of filter. And first of all, makeshift filters. Makeshift filters are used when sterile filters are not available, and they include cigarette filters, rolling filters, and various pieces of cotton. None of these filters are sterile, and because of the necessary contact with fingers and or mouth before use, their use is associated with infectious risks. In particular due to bacteria present on the skin and in the mouth. In addition to that, makeshift filters have no demonstrated efficacy to remove solid particles, and as a consequence, their use is not necessarily recommended. The second type of filter that people who inject drugs may use is sterile cotton filters. We can also find similar filters made of different materials, such as cellulose acetate, for example. So sterile cotton filters are intended for the filtration of drugs, and they are widely used in many countries because of their efficacy and affordability too. They are indeed effective to remove insoluble particles from 10 microns, which corresponds to the size of most harmful particles. It is very close to the diameter of blood capillaries, which is why it's important to be able to get rid of these particles. It's also important to keep in mind that even if sterile cotton filters are intended for this use, the efficacy will always depend on the initial amount of particles in the mix, their nature, and the quality of the gesture itself. For example, if the tip of the needle is not at the center of the filter during the filtration, it may have a small impact on the filtration efficacy. The same is not true for membrane filters, which efficacy directly depends on the size of the membrane pores, and for which the efficacy doesn't depend on the initial amount of particle in the mix. One last thing to mention about sterile cotton filters is that their reuse and sharing tend to be quite common habits for some persons, and this can lead to infections, mostly bacterial and fungal, especially when the filters are kept in a wet environment. And when those filters are shared between different persons, they can also lead to the transmission of bloodborne viruses, HIV or hepatitis C, for example. Now we will see different membrane filters, starting with 10 micron membrane filters. So all membrane filters are used directly on syringes, with or without needle, and membranes act as physical mechanical barriers that stop contaminants so that they don't end up in the injected solution. In the case of 10 micron filters, the membrane will filter solid particles, and their use reduces risks associated with their injection. The Stereofill Basic is more adapted to powders, and the Stereofill Fast more adapted to crushed medications, thanks to its larger membrane, so the membrane doesn't clog. Because they have the same membrane type, they will both be as effective and can remove up to 99% of solid particles, depending on the initial amount of particles as well as their nature. As seen before, 10 micron and more correspond to the size of particles the most likely to obstruct blood capillaries and therefore the most harmful particles. This is why removing them is beneficial before the injection. Because the membrane is rather a network than a grid in terms of space configuration, it will also remove a significant amount of particles from 5 microns, providing additional protection against particles. Here you can see microscopic photographs of before and after filtration with two different types of filter. On the left picture, you can see what Subutex, which is an opioid substitution treatment available in France, looks like in water. So you can see the amount of insoluble particles. In the center, you can see what the solution looks like after a cotton filtration. And on the right picture, you can see what it looks like after a 10 micron membrane filtration, where most of insoluble particles have been removed. The best filtration level that can be reached is the bacterial one, which corresponds to 0.2 micron, and so to bacterial filters. We can find such membranes in the Stereofill Plus and in some wheel filters as well. In addition to removing all particles, bacteria and fungi will be eliminated as well, considerably reducing infectious risks if other disinfection measures are also observed. We'll get back on that point in the last part of this presentation. In this second part of the training, you will watch videos that show how to correctly use different filters with explanations and demonstrations. Once the preparation is ready to be filtered, carefully drop the cotton filter directly from the package into the cooker without touching it with your fingers. If necessary, turn the filter with the tip of the needle or syringe. If you are using a syringe with a fixed needle, insert the bevel tip of the needle into the center of either flat side of the filter. If you are using a syringe with no needle, place the tip of the syringe on the rounded part of the filter and press down lightly during filtration to prevent the aspiration of air bubbles.
This video will demonstrate how to correctly use SteriFilt Fast and SteriFilt Plus. SteriFilt filters are an important development in the field of harm reduction in injection drug use. They both offer high filtration performance, protecting against the injection of insoluble particles, fungi or bacteria, depending on which filter is used. Although they have different filtration capacities, both filters should be used in the same way. Here we will use the SteriFilt Plus with 3 different syringes: a needless syringe, a BD insulin syringe, and a B Braun OmniCan syringe. SteriFilt filters are compatible with the most common syringes used for injection drugs, whether with a fixed needle or needless with luer slip tip. However, SteriFilt cannot be used on needless syringes with luer lock tips. SteriFilt comes in sterile packaging. To use, gently remove the paper lid, then tilt the SteriFilt while making sure not to touch it directly with your fingers. It is important to always avoid touching the filter to prevent contamination with bacteria on your hands. Next, insert the syringe into the filter. To ensure a good seal between filter and syringe, twist the syringe within the filter 1 full rotation. The filter is now correctly positioned. Here is the same process with a BD syringe with fixed needle. Open the SteriFilt wrapping and tilt the filter upwards, again being careful not to directly touch the filter. Insert the syringe. Seal securely by screwing the syringe firmly in place. For the OmniCan syringe with fixed needle, the manipulation is slightly different. There is no need to screw it in. Just press firmly until it clicks, which indicates that the filter is properly positioned. To avoid damaging the needle against the inner wall of the filter, stabilize the movement by placing your elbows on the table or on your lap. For this demonstration, we are using 0.7 milliliters of product in a Steri cup. Be careful not to flatten the SteriFilt ring against the bottom of the cup to avoid a suction effect. Draw the solution into the syringe by slowly pulling the plunger back. You have now obtained a clear, filtered solution without altering the active product. The SteriFilt can now be removed and discarded. It is necessary to remove any air bubbles before using the syringe. To do so, hold the syringe vertically with the needle pointing upward. Tap on the syringe to make the bubbles rise and then expel them with the plunger. The filtration process is now complete. If you are having trouble drawing the liquid, it is likely because the seal between the syringe and the SteriFilt isn't adequately tight. Firmly push the syringe within the filter to secure it. In rarer cases, the cause may come from the presence of excess plastic on the syringe. Scratch it off. It's important to remember, changing filtration method is not easy for everyone. Practicing in a calm environment, using water, will help you get used to it.
In the last part of this training, we will briefly review preventable infectious risks and hand hygiene more in detail. It is important to keep in mind that using a bacterial filter is not enough to prevent all infections, because infectious risks associated with injection drug use are mostly due to the preparation and the injection. Person's own skin and oral flora is the most frequent cause of contamination leading to infection in persons who inject drugs. So this can be due to a contact between the fingers and the drug when the drug is not already contaminated when it's bought. It can also be the contamination of skin near the injection site or contact between saliva and the needle or the injection site. Some contaminations occur after the filtration is done, and in this case, the bacterial filtration does not necessarily prevent infections. A recent study conducted in a group of persons who inject drugs demonstrated that 57% of infections related to injection drug use were caused by Staphylococcus species, which are bacteria naturally living on the skin. and 54% of infections were caused by Streptococcus species, bacteria notably living in the mouse. So this suggests that most infections are due to insufficient skin disinfection or contamination occurring after the filtration. There are several ways to wash hands, and this should be done for every injection in order to prevent infections. Basic educational intervention on that can really make a difference and reduce injection drug use related infections. Hydroalcoholic rubbing using a hand sanitizer is the best option when it is available because it will lead to the complete decontamination of skin. It is also the technique that is recommended by the World Health Organization for hand antisepsis in healthcare settings. When there is no better alternative, washing hands with water and soap is better than no hand wash, and it will still reduce the number of germs on hands. Wipes are sometimes used as well. Their ability to kill bacteria and viruses should be verified, as there are many different types of wipes and not all of them are disinfectant. Before concluding this presentation, I will briefly mention the fingertips first hand wash technique, as it can easily be implemented for persons who inject drugs, and this technique has demonstrated to be effective and acceptable. So this technique is a simplified alternative to the World Health Organization's 7-step technique, and it focuses on most contaminated areas on hands, namely fingertips and nails. This training is now finished. Thank you very much for attending, and feel free to contact us if you have questions or would like to share a comment. The videos you have watched are available on our YouTube channel, and you can also find more information on our website.